Good morning. My name is Kaylee Bradley. I'm a licensed professional clinical mental health counselor with supervision designation here in the state of Ohio. I'm also a nationally certified counselor and also hold certification as a thanatologist. I am one of this year's emerging leaders for the Association for Child and Adolescent Counseling. I'm also the president-elect of the Association for Child and Adolescent Counseling Ohio branch. I'm a doc student at Ohio University, adjunct professor at Marian College in their online thanatology program, where I teach courses in childhood bereavement, pediatric hospice care, and expressive arts and counseling. Lastly, I co-own a small private practice, Refuge Counseling LLC, here in Ohio. I've been tasked with kind of setting the groundwork for our presentation. So I'm going to begin with some statistics. It's estimated that over 7.3% of children are predicted to experience the death of a parent or sibling by the age of 18. According to the JAG Institute, which is a wonderful entity that does research on childhood bereavement, 1 in 12 US children will experience the death of a parent or sibling by the age of 18, which is approximately 6 million children and adolescents. I don't know about you, but those numbers are overwhelming, right? The loss of a parent or another caregiver is significant. It's a significant moment in the child's life. And though many bereaved children exhibit resiliency, children who experience bereavement are at a higher risk for mental health diagnoses like depression, anxiety, alcohol and substance abuse disorders, suicidality. Unfortunately, children from poor communities are at even higher risk for these poor outcomes. Children and teenagers face unique challenges and a range of emotions, just like we do as adults, right? They're confronted with big emotions, somatic symptoms, belly aches, headaches. We'll talk a lot more about that throughout the presentation today. Cognitive distortions, and that's a big fancy word for things like magical thinking. Did I do something that caused my person to die? Okay. In my experience as a hospice bereavement coordinator who primarily worked with children and adolescents, I heard this a lot, right? That sense of, did I do something wrong? Okay. Also an awareness of mortality, those big existentially questions. That's all normative, right, for children and teens in the grief process. The COVID-19 pandemic has certainly brought increased attention and awareness to the impact of childhood bereavement. As the more than 1 million COVID-19 deaths in the United States include parents, grandparents, and other caregivers for children. I also want to share a few misconceptions about childhood bereavement. I think there are a lot, so this is by no means an exhaustive list. But many misconceptions exist regarding children in grief. Things like children are automatically resilient, so they don't really need support after a loss. Okay? I would argue that yes, children are very resilient, but they need a supportive environment for that resiliency to flourish. Children don't understand loss, right? So there's my friend. This is Jem. Children don't understand loss. So they shouldn't be talking about it. They don't really comprehend it. And actually bringing it up only makes it worse. Okay. Children do understand loss. Okay. They deeply understand. I love the Fred Roger quote that says, what we talk about can be manageable, right? So children do need safe spaces to explore and to process and to be able to practice identifying their feelings and their experiences. Children who experience loss shouldn't attend the funeral. This is a big question I get as someone who kind of specializes in childhood bereavement. Should I take my kid to the funeral? I think by and large, yes. I think it's a tremendous opportunity for children to engage with the process, to engage with the grieving process, the dying process, okay? There's a lot more I could say on children and funerals, but for time's sake, I'll just keep it brief, but certainly if there are further questions you want to explore that, I'd be happy to facilitate this conversation. Here's a few more. Children only grieve for short periods of time. childhood grief is developmental, meaning how I experienced it at one point may be very different later on and down the road. Okay. A child's grief proceeds in nice, predictable, orderly stages, linear. Unfortunately, I don't think any of us, right, experience the stages of grief as we've kind of appropriated them, right? And so it might be, one day a child seems okay, and then the next day something kind of activates that grief process. Infants and toddlers are too young to grieve. What we know is that if we are capable of attaching, which infants unbelievably are, then we are capable of grieving, right? Grief is a severed attachment. Here's another big one. Children grow up to be maladjusted, or grieving children grow up to be maladjusted adults. I think this speaks to the importance of support, right? I like to say that grief counseling and grief support for children and teens is preventative mental health care, because I think when we actually spend time talking about these underlying emotions and feelings surrounding grief, it can very much help developmentally, not just in that moment, but down the road, having those safe spaces. This one again is repeated here because I do think it's important. Children are better off if they don't attend funerals. Again, what we know is that it's actually very helpful for children to attend funerals. If you want specific guidance on that, the National Alliance for Children's Grief has some wonderful resources and suggestions on kind of some tips and supports that you can offer children during funerals. All right, thank you so much.
Hi everyone, my name is Emma Forner. I am a current emerging leader for ACAC, and I am currently working to obtain my master's in clinical mental health counseling from Youngstown State University in Youngstown, Ohio. So today I'm going to be talking about grief throughout development. So when we think about grief throughout development, some of the key points here that I want to share. Children's understanding of the concept of death and their developmental level are key factors in understanding their responses to death. In addition, their developmental level as well as their age helps us to better understand their understanding of irreversibility, finality, inevitability, and causality. All children react to the death of a loved one, but their developmental level can predict one, how they understand death, and two, how they experience or make sense of the loss. Manifestations of grief will shift throughout development, as I will note on the following slides. Okay. So, if we first take a look at infancy to age 2, babies do not have the cognitive capability to understand an abstract concept like death. They function very much in the present. So, when someone significant dies, babies are more acutely aware of loss and separation. They react to the emotions and behaviors of significant adults in their environments, and to any really disruptions in their nurturing routine or schedule. If there's a sudden change, they may experience a tremendous amount of discomfort. With this group or at this stage, typical grief responses. So babies may search for the deceased and become anxious as a result of the separation. Other common reactions include irritability and protest, constant crying, a change in sleeping and eating habits, decreased activity, and weight loss. Moving into preschool age. So, preschool children do not comprehend the concept of forever. For this age group, death is seen as temporary and reversible. Even when a preschooler is told that mommy is not coming back, for example, an hour later, they're asking, where is mommy? So, preschoolers also do not usually distinguish life from death, nor is it something that can happen to them in their minds. So, as we all know, preschool kiddos love to play peekaboo, where a significant adult in their life disappears and then reappears after some time. So, it's through games like these that these kiddos slowly begin to understand the concept of gone for good. So, the grief response here, because they tend to be more present oriented, their reactions can be brief but very intense. So, at this stage, children are learning to trust and form basic attachments. So, when a significant adult in their life dies, they become very concerned about separation and altered patterns of care. They typically have a heightened sense of anxiety. And like infants, they respond to the emotional reactions of the adults in their environment. So, if they sense that a parent is worried or sad, they may cry or have a tantrum because one, they are concerned, or two, as a way to distract their parents from difficult emotions. Um, Typical grief responses of the preschool child include confusion, nightmares, and regressive behaviors like bedwetting, inconsolable crying, thumb sucking, temper tantrums, and withdrawal. They might search incessantly for the deceased despite assurances that that person is not returning, and may even be anxious around strangers. Moving into early childhood. So, as with preschoolers, this group views death as temporary and reversible. They sometimes feel responsible for the death because they believe that their own negative thoughts or feelings about the deceased might have caused their death. So, this sort of faulty thinking stems from the belief that everything in the environment revolves around them and that they can control what happens. Even when children at this age are exposed to death through the media or peers at school, they may still believe that you can avoid death if you are careful enough. Children at this age may also make uh, connections between occurrences that have nothing to do with each other. So, for example, if a child bought a toy on the day that their sister died, they may attribute the toy to causing sister's death, especially if the death isn't fully explained to that kiddo. So the grief response, as with preschoolers, this age group may repeatedly search for the deceased or ask where they are. Repetitive questioning about the death process is also common. So, what happens when you die? How do dead people eat? Are a few examples. They will often express their grief feelings through play instead of words. So, themes of family loss and death may surface as they play with dolls and action figures. They may play act the death and itself and the funeral. Sometimes children at this age appear unaffected by the death. So, not as if nothing happened, um, but this doesn't mean that they're oblivious or that they have accepted the death. It might just signify their inability in the moment to acknowledge that this painful reality. Like the prior stages, they may model the grief reactions of the adults in their lives who are feeling uncertain how to express their own feelings. Other typical responses to grief include anger, sadness, confusion, difficulty eating and sleeping. This group may also regress as a way to seek more nurturance and attention during this difficult time. Children who have experienced loss at this age tend to be fearful that other loved ones will leave them as well. And they may also form attachments to people who resemble the deceased in some way. Moving into the middle years, so 7 to 10 years old, this age group, tends to see death, begins to see death as final and universal. These children in this group sometimes visualize death in the form of a tangible being like a ghost or a boogeyman. Curiosity spikes, so very curious about the details of death, cremation, burial. So they may ask very candid questions. And even though they know that death can happen to anyone, and that there are many things that cause death, They still do not typically think of it as something that can happen to them or their family. They believe that death only happens to people who are very old or very sick. So, death is escapable for these kiddos. They may also view death as a punishment, excuse me, and sometimes they are unable to comprehend how the death will impact their life, resulting in increased anxiety. Children in the middle years, often become very concerned with how others respond to the death by focusing less on themselves and more on others. They fear that other loved ones may die as well, and they might begin to fear about their own health or bodily harm um, for themselves. Some children in this group might act out their anger or sadness or be unable to concentrate at school. Others may withdraw or hide their feelings, and other typical reactions, shock, denial, depression, eating and sleeping changes, and regression. This age group tends to tap more into coping strategies than younger kiddos. Um, so, some children, especially those who have a difficult time expressing their feelings verbally, might play act through war games or other activities. Children in this age group might assume the role or the mannerisms of the deceased or take on chores or roles that that individual previously performed, such as care for their siblings. They also may idolize the deceased in some way as a way of maintaining that bond with them. Moving into pre adolescence. These kiddos conceive of death in much of the same way as children in the middle years, with a few additions. So, pre adolescents are in the process of establishing their own identities, gaining more independence from their parents and other adults, and creating stronger ties with their peer group. So, in understanding death, pre adolescents attempt to understand both the biological and emotional processes of death. They are, however, more able to understand the facts surrounding the death rather than the feelings or emotions circulating the death. It's common for pre adolescents to want to cover their emotions or their feelings so as to not appear different from their peers at school or in other social groups. They fear that expressing sad feelings may be a sign of weakness, so for this reason, they may appear indifferent or removed. They may also express grief uncharacteristically through anger, angry outbursts, irritability, and bullying. We also tend to see physical symptoms manifest like moodiness, changes in sleeping and eating patterns, indifference toward schoolwork, or isolation from their peers. They might worry about the practical issues after death, such as how the household will survive, or really just in general, how they'll be cared for or taken care of. They also might have questions regarding religious and cultural beliefs about death, too, during this stage of development. Okay, I'm going to turn it over to Juliet. Thank you all.
Hi everyone, I'm Juliet Cahow and I am one of ACAC's emerging leaders for this year. And I am also a second year master's student at the University of Central Florida, where I'm pursuing my degree in clinical mental health counseling and a certificate in play therapy, which is my true passion. And I hope to someday work with children and families as a play therapist. I'm interning, working with this population and focusing on developing child-centered play therapy skills, as well as child-parent relationship therapy practices, both of which I hope to integrate as a future clinician. However, right now I'm in the midst of a gap year working in Shanghai, China, and hoping to improve my cross-cultural competency as a future clinician, which is really important to me in my practice. However, today I'd like to chat with you about the impact of grief and loss on children and adolescents. And when I say impact, I'm considering that in terms of multiple facets of a child's life. So their psychological, cognitive, and somatic functioning, and how a grief or loss experience could impact all of those arenas. And I also want to consider the impact in terms of the child's life and their particular context as an individual. So, really thinking about the whole child, situationally, somatically, psychologically, etc. First of all, taking a look at the psychological and cognitive impacts of a childhood loss. Also, I know that Emma already spoke a bit about developmental concerns, and some of these may overlap, but here we're really talking about general trends that transcend the entire child and adolescent spectrum, so they could occur at any point within that bracket. So a few of the concerns that you may see could be behavioral. So children may experience an increase in aggressive or destructive behaviors at home or in the classroom, as well as attention deficits or language delays. There's also a whole nother subset of symptoms that could increase for children after experiencing the loss of an adult or caregiver in their life, including self isolation and withdrawal. And so, really mimicking depressive symptoms, though the underlying concern is really grief and loss. There's also the potential for them to have increased emotionality as they're learning how to process these intense and new feelings, um, which can range from frustration to potentially guilt related to the loss, blaming themselves or others. There's also some intense symptoms like preoccupation with death, meaning that they are having these thoughts that are intrusive in nature, not being able to stop thinking about death, potentially having nightmares about death, or simply wanting to know what death means or trying to process um, the concept of death. There's also the potential for them to experience suicidal ideation. So when I spoke earlier about depressive symptoms taking place for children who've experienced an intense loss, this can also include suicidal ideation or behaviors. And so it's important for clinicians to screen these depressive symptoms for the potential cause underlying them being grief and loss. Additionally, there are some physiological concerns. So, a lot of these are short-term effects. So, after experiencing the loss of an adult or caregiver, children may have an increased frequency of complaints like headaches, stomach aches, joint pain, muscle fatigue, lack of energy, sleep disruptions or nightmares, like I said, chest tightness. Um, so things that may not seem related to grief and loss, but really do stem from the concerns that they're not able to verbalize. However, in the long term, the literature has not pointed out a distinct linkage between the loss of a parent during childhood and long-term health effects, which is an encouraging finding. However, I do want to circle back to that in just a moment. So thinking about the magnitude of the impact on a child or adolescent, um, we have to think about it contextually. So, no child exists in a vacuum, as we know. And so, specific aspects of the loss or their life could really play into how intense these symptoms are for them. So some of these could include, you know, what happened in terms of the loss? That what were the mechanics of it? Was it something the child saw? Was it witnessed by them? Was it violent? Did we anticipate that this loss was coming, or was it sudden? Did the child feel out of control in the instance, or did they know that this was something that was going to happen? So thinking about the actual incident itself as well as how the loss was communicated to the child. Um, who told them? What was the environment like? Was it chaotic? Thinking about how that could intensify some of the symptoms that the child experiences after the fact. And then, was the child afforded any opportunities to grieve? Did they get to attend the funeral, like Kaylee mentioned earlier, being an important part of allowing them to process? Were there any protective factors in the child's life? Do they have a robust support system outside of the individual that they lost? And then, of course, thinking about intersectionality and how the child's other identities may privilege or disadvantage them in some ways. So, for example, is the child socioeconomically disadvantaged as well as experiencing this loss of potentially of a caregiver? And how does that further then strain them in terms of losing resources that they need to survive? Um, so those considerations are really key to understanding the impact of a loss on a child. And then taking that a step further, not only was this loss intensified by some in some ways, but then was the loss processed by the child as a traumatic event? Because we now know, thanks to the work of the ACEs study, the adverse childhood experiences, that if this was experienced by the child as a traumatic event, with increased ACEs comes increased long-term health consequences. So, like I said earlier, while there's no um, demonstrable linkage between experiencing a loss in childhood to long-term health outcomes, if it was coded as a traumatic event, that may not particularly be true, because if they do have a significant amount of ACEs, they may have um, a significant outcome later in life. And while original surveys don't include the loss of an adult or caregiver in childhood as a traumatic event on the ACEs study, um, many surveys have now been expanded and so could potentially include this as well. Also thinking about the potential for it to be a traumatic event, just giving an example, considering like parental death during COVID-19, the circumstances surrounding that loss were traumatic for many children as part of a global pandemic, and so that just may be one illustrative example of traumatic loss. And then also just considering that uh, traumatic elements of a death may be more subjective for children than adults. And so they may have a more intense experience than we would anticipate. And so just being considerate of that as well, and how that impact may extend into the child's life. A lot of the suggestions here of like what symptoms could look like for a child experiencing grief and loss were taken from doctors Rebecca Bird and Sonia Laurel's presentation at this year's ACAC conference. And so I encourage you to also look at their publications regarding childhood bereavement as a supplemental resource for your learning.
So now we will move into discussing treatment modalities, where I will specifically be discussing play therapy and its effectiveness with child bereavement. And so before I begin to discuss play therapy as an appropriate modality, working with children that have experienced grief and loss, I want to first introduce myself. My name is Samantha Long, and I am one of the Association for Child and Adolescent Counseling Emerging Leaders. I recently obtained my PhD in counseling from George Washington University. In addition to that, at George Washington University, I hold two positions, which include the clinic director of the Community Counseling Services Center that is based in Alexandria, and it is housed within the School Counseling Master's Program. And in addition to that, I also teach as an adjunct professor at George Washington University. And so one of the leadership positions I have held and I'm currently holding is really involved with the Association for Play Therapy. And so I have been a past co-chapter chair for the Northern Virginia Association for Play Therapy chapter, and I am currently one of the co-regional leaders for the Virginia Association for Play Therapy at large. And in addition to that, I specialize working with children using play therapy at a nonprofit organization that is housed in Haymarket, Virginia. And so where I thought would be most helpful to begin is to talk about play therapy really really looking into some of the foundational aspects around play therapy. And so first, I will share the definition that has been created by the Association for Play Therapy that defines play therapy as the systematic use of a theoretical model to establish an interpersonal process wherein trained play therapists use the therapeutic powers of play to help clients prevent or resolve psychosocial difficulties and achieve optimal growth and development. And so, keeping this definition in mind, play therapy offers the therapeutic powers of play, which include facilitates communication, fosters emotional wellness, enhances social relationships, and increases personal strengths. And so the second piece here that is really important is play is a natural form of expression for children. And so to really break this down a little bit more, through the use of play therapy, children are able to use the toys as their way of communicating how they feel internally that they may not be able to put into words, but they may be able to show through actions with the toys. Through the toys, the expressive mediums, the room and the play therapist will become a container to really help facilitate the child being able to play out some of those really tough emotions. And the toys may also offer the ability for some self-regulation, such as being able to scoop and pour sand. And so, because play therapy can be metaphorical and symbolic, play therapy can offer children a safer way to explore a scary situation, a sad situation, a situation that brings a multitude of emotions. And so, really, through that imaginative play, using the toys, using the expressive mediums, they may be able to process through their grief and loss experiences without the spotlight being on them, but maybe it is on the lion or the baby doll, which sometimes can feel a lot safer for children. And again, just recognizing that not all children have the exact same cognitive abilities. And so we really have to think about how play therapy is a developmentally appropriate approach for children, especially children that have experienced grief and loss. And so the play therapist, this is one of the really important things that I think I will speak about in a moment as well. The play therapists themselves, they are present, they observe, they empathically listen, and they're really recognizing the child's needs, wants, and feelings. And so, again, as I had mentioned, the play therapist in the room really become a container for the child to be able to really explore the range of feelings that might be emerging through the loss of a loved one or loved ones. And so with that, a sense of security, predictability, and consistency from the therapist can help the child feel safe within the relationship. And as the play therapist is attuned with the child, they can then respond to some of those nonverbal cues regarding processing to really start to assist in facilitating the child moving from dysregulation to regulation, if that is something that's being worked on based off of the grief and loss experiences. And so for children that have lost a caregiver, for example, this therapeutic rapport is a helpful avenue for children to process their feelings and know that they have a predictable adult who is attuned to them and their needs. And so additionally, through the use of child-parent relationship therapy, which has a foundation in child-centered play therapy, this can also assist children and a caregiver to maybe do some repair work regarding their relationship and really starting to process the grief and loss together. And this also could look like involving surviving caregivers in the play therapy room through more family-based interventions if you're not necessarily doing child-parent relationship therapy work. And so these playful activities help promote attunement, relational connection, and co-regulation in children. And so I want to also share this quote by Gary Landreth The play therapist knows that being present with the child requires much more than a physical presence. Being with is truly an art form that makes the play therapy experience unique for the child. And so next we will move into the play therapy room and toys. And so what you'll see here, this is based off of Gary Landreth's book, Play Therapy, The Art of the Relationship, the 3rd edition. And you will see that there are 3 categories. And so under real life toys, you see a doll family, doll house, puppets, nondescript figures, vehicles, cash register, medical kit, kitchen food. For the second category, acting out aggressive release toys. So this might be your bop bag, your toy soldiers, your alligator puppet, knives, swords, and guns you will see is listed here. I just want to make a note that, of course, in the playroom, we all have our limitations. And so this would be something potentially that you may want to consider if having guns in the playroom is going to activate you. It may not be best to have in the room, as we know that children can use toys in many different ways. And so if that's something they need to express, they can express that. But again, everyone has the right to their views regarding the toys in the playroom. And this is based off of Landreth's list of items in the playroom. And then the third category is toys for creative expression and emotional release, which includes sand and water, blocks, paints, and coloring materials. And so what is truly unique in play therapy is that a child, for example, maybe they lost a loved one from a medical illness. And so in a play therapy room, you are likely going to have a doctor's kit. And so by having this doctor's kit, this may then allow the child to explore and process in a safer way to then start to make some sense about what they observe that maybe happened to a caregiver. Or maybe because of imaginative play, a child may use sand tray miniatures to explore their thoughts and feelings through that symbolic play in the sand tray. And so more humanistic play therapy approaches are going to allow the child to choose how they need to process and when they need to process. And this is not something that would be guided by the therapist per se. And so play therapy as a healing modality, why are we talking about play therapy when thinking about children that have experienced grief and loss? So there's a few things that I would like to state here. So again, play therapy is the natural form of communication for children, meaning that children do not always have the same emotional and cognitive abilities as adults do to process their internal thoughts and feelings, especially about grief and loss. And so this is a play therapist way of meeting children where they are and using their natural form of communication. It is also can be a safe environment for children to explore their feelings. And so one of the things you'll see here in asterisks is cultural considerations. And so when we're thinking about exploring their feelings, there's one cultural considerations to keep in mind. And so one of the things that is going to be necessary is making sure that you as the play therapist or the counselor are working with the caregivers that might be involved in the family to understand their cultural values and beliefs and understanding about the grief and loss process. And in addition to that, recognizing that some cultures they may process grief and loss differently. And so it's important for us as play therapists to make sure that we're not allowing our own assumptions to get in the way. And then it become, for example, pathological if a child is not sad, right? And so when thinking back to this second point here, to explore their feelings, maybe they feel really angry that they lost one of their caregivers, for example. While maybe there is some sadness, maybe the anger is there first, or maybe there is a sense of relief. Maybe they have seen their a loved one go through a lot of pain, a lot of suffering. And so what we want to be mindful of is that through more like humanistic approaches, this is going to give the child the opportunity to process how they need to process, which may not just mean sadness or just the grief and loss, that there may be a lot of other feelings and internal experiences attached, that in that play therapy room, we are allowing them the space to process how they need to. And so in addition to that, um, play is really seen as a valuable and therapeutic tool to really help children make meaning of their experiences. And so through the use of toys and play and how they're utilized, it can really help to assist in the healing process through like imagination, through the symbols, through metaphorical work. And so in addition to that, play therapy can support healing attachment injuries. And so, as I had mentioned a few times, by being a predictable, consistent, and safe adult, this can not only allow the child to process what their experiences have been and their feelings, but what we know about the therapeutic rapport is when you really have that safe and stable relationship, the child would then really be able to explore without verbalization, without judgment, without external pressure. And with that, again, I'm thinking about if a child had lost a caregiver and maybe their other caregiver has been overwhelmed in their own grief and loss process. Maybe there are other family members and other children and siblings involved, and one of the children are, really struggling, that they feel like not only did they lose one of their parents, they feel really disconnected from their other caregiver. And so the play therapy space can not only be helpful for that child to feel safe and heard and understood by the play therapist, it may also then lead to conversations about how might we really start to bring in caregivers or other loved ones to really start to work on some of that repair work. But inevitably, if there is a safe therapeutic rapport, that rapport can be incredibly helpful for the child to know that they have something very safe and something secure that they know that they're going to continue to have while they're processing through some of their feelings. And so what I wanted to end on today is to provide some case examples. And so the first case example, we will call him Billy. Billy lost his father, who was killed in combat in Iraq. And so after learning about his dad's death, Billy had developed serious nightmares and separation anxiety that was so severe that Billy could not tolerate being out of his mother's sight, especially outside of the house. At night, when Billy experienced nightmares, his mom would get extremely anxious herself and had great difficulty calming herself down, and enough so that she could comfort her son. His clinginess during the day would increasingly frustrate his mother, causing her to become more and more impatient with Billy, which only made him more anxious and clingy. During a pediatric appointment, Billy's mom shared some of his struggles and was referred to filial therapy with a well-qualified play therapist. The play therapist explored the presenting issues and then demonstrated the 20-minute special playtime for non-directive play for Billy and his mom in the play therapist room. When Billy began to play, he went straight to the dollhouse and found a set of small soldier puppets. He placed the soldiers around the dollhouse and put 2 male puppets inside the house. The play therapist verbalized Billy's actions and reflected the tension in his voice and body as he placed the soldiers outside and the 2 male puppets inside the dollhouse. He called the latter the quote unquote bad guys that were hiding from the quote unquote good guys outside. As he continued to move the bad guys into protected positions inside the dollhouse, Billy became increasingly tense, which Billy's mom reflected as him becoming anxious. Billy yelled out, "I am scared of the bad guys," and moved away from the dollhouse, ignoring the soldiers that had been placed outside of the house. The play therapist slowly followed Billy away from the dollhouse, validating his anxiety through empathic reflection. Billy then took out some paper and crayons from an art supply box nearby and drew scribbles, mainly using a black crayon for the rest of the session. During the second session, Billy's mom reported a decrease in nightmares. As Billy continued to explore and process through this play, and his mother reflecting after the following weeks, the nightmares almost stopped completely, and his clinginess decreased, and his mother became less anxious and more patient with Billy. And so that is one case example. And again, what you heard is that this play therapist had a dollhouse and had puppets. And then it sounded as though that there was also some soldiers. And so again, while this wasn't necessarily something like imaginative, such as like using a lion or a zebra or some sort of animal to represent the good and bad guys, quote unquote. However, what we saw is this child was able to use the dollhouse and use these the figurines and use the puppets to process through something that he has been holding on to. And so the second case example that I want to share, we will call him Brett. He lost his father, who was killed in the September 11th terrorist attack. And so this case example included Brett and his mother, who engaged in parent-child conjoint play therapy. Brett's mother struggled to manage Brett's needy behaviors and aggressive attention-seeking behaviors. These behaviors developed after his father's death and escalated after the birth of a baby brother. During the first parent-child conjoint session, Brett went straight to the dollhouse and initially played out scenes of death and destruction, with all the people dying and the furniture going into the dumpster. For several weeks, Brett repeated the themes of death and destruction, either with the dollhouse or with blocks. Often he followed this play by moving close to his mother and seeking her reassurance. Brett used play therapy to play out his anger and to portray the destruction of his life. As his mother witnessed this and expressed appropriate feelings and then helped him recall some happy memories, he then started to engage in other types of play, with one example of wrapping up selected toys in the office and then offering them as gifts to his mother. Over a 6-month period, this conjoint play therapy helped his mom become more sensitive to her son's needs, excuse me. Play therapy also gave Brett opportunities to express his anger and fear in his mother's presence without incurring her disapproval. Play therapy enabled Brett to play out his anxieties in a supportive environment. And so I think one of the things that's really important to name here is Brett would come in and have a similar engagement in his play. So the play therapist and mom were able to see that he's continuing to come in and he's really processing something. He's really playing out something. And then as the work continued, the therapist started to see a shift and mom started to see a shift. And that oftentimes is what we see is there are shifts in the play, in the themes that we're seeing, which can be a sign for us that the child has processed something. And again, there may be numerous reasons why the play is shifting, but one potential reason is there was some sort of meaning making, there was some sort of resolve that happened.